As a regenerative medicine doctor, I see things a little bit differently, where I get patients that have grade 3, grade 4 osteoarthritis, and they're looking for alternatives to getting surgery or taking opioids. And the idea is that you can use different things like physical therapy to correct some of these biomechanical aspects, and then layer in naturopathic principles of diet, lifestyle with the innovation of regenerative medicine. And I have a hard time saying reverse, but just because the studies that support regenerative medicine, there aren't a lot of different studies that completely show complete reversal of a grade 4 osteoarthritis.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. This is your host, Dr. Kevin Wall. This is a podcast that exists to help you unplug you from the matrix of today's healthcare system. People are so confused, misled, misinformed, and we're here to help shed some light on a lot of confusion that's keeping our world chronically ill. I talk about the Matrix, and I often make references to the movie, and I'm curious because at this point I didn't realize that movie's been out there for 20-some years, I think, and I'm wondering how many people even know what I'm talking about. I went back and rewatched it a couple of weeks ago to just remember and remind myself of some of the parts of the movie. And man, it was prophetic for what is truly going on today in our society, and again, the misleading misinformation. So I'd encourage any of you to go back and watch that movie. It's interesting, and I think you'll see some of the reasons that we bring those references into our podcast. Today, though, our topic is not the Matrix. In fact, have you ever had or invited or noticed that the Itis brothers ever visited your home? Most of us today have had or still today have the Itis brothers not only visiting but residing in our homes way too often. You know what I'm talking about, the Itis brothers, right? Tendon, bursa, myositis, tendonitis, bursitis, gastritis, myositis, pancreatitis. All the Itis brothers, you've met them before, haven't you? And of course, the two most famous Itis brothers, rheumatoid Arthur and osteoarthritis, the Arthur brothers, arthritis. Man, today 21% of Americans are dealing with arthritis, some variation of arthritis. That's around 53 million Americans have an arthritis. It is an epidemic. Unfortunately, many of us have the Arthur brothers hanging out way too much. And today our podcast is going to be about arthritis, not only the causes, the reasons, but why you still have it and how to get rid of it. More logical, natural ways to resolve the arthritis, the Itis brothers. But before I go down the road of all of the arthritis brothers, I want to just back up to the actual beginning there, which is the craziness of this term itis, because often we are playing what I call name that tune. It's again a reference to, unfortunately, my age and a few old game shows. If you've never seen the old game show Name That Tune, this is so exact to our big pharma allopathic diagnostic world that we live in today. This show was a show where they would play a tune and they would guess how many notes it would take for them to name it. So 3, 4, 5 notes, and you would name that tune. Well, this is exactly medical diagnosing today. It's called Name Your Symptoms. That's it. And what a great gig this is. You come up with a symptom, they come up with a name with it, they come up with a diagnosis, and of course, then they come up with a medication that they're going to give you probably the rest of your life. Well, for you to unplug from this matrix, this redundant carousel of just medication for side effects of medication, you've got to first understand some basic principles of some of these names that you have been given, these terms, these diagnoses. And the most common ones are the Itis brothers. See, when you talk about problems with your tendon, they say that you have tendonitis. Well, understand itis just means inflammation. Something's sore, something's inflamed, something's red, something's irritated, something's painful. See, if your tendon is painful, you have tendonitis. If your stomach is uncomfortable, you have gastritis. If your pancreas is not working, you have pancreatitis. If my bursa are inflamed, you have bursitis. See, this is the game. These are not diseases. These are not the reason that you're uncomfortable and having trouble and can't move and can't sleep and can't digest and are having trouble with your blood sugars. See, these are the results of something underlying. These are the names of your tune. See, I can name your tune in 2 symptoms. Your tendon's sore, you got tendonitis. See, you see the redundant cycle here that is so concerning when you're watching it, with the understanding that these are just names for your symptoms. And we've got to stop naming your tune, and we got to find solutions. We got to stop giving you medications for every time you feel something and trying to ask this question: why is my tendon inflamed? Why is my bursa inflamed? Why is my stomach inflamed? Why is my pancreas? Fill in the blank. Whatever itis you have, you need to ask the question, why? Why is that thing so irritated? And when you start asking the question why, you now have the chance for a real solution. You now have the chance to unplug yourself from this matrix I'm talking about. Well, today, if you will, I've invited in an expert, of course, to help us unplug from the Arthritis brothers. Would you welcome to our show Dr. Mareshah Dunning from Solutions Regenerative Medicine? Doc, it's great to have you. Welcome to our show.
Thank you so much for having me. I really appreciate you letting me come talk to you about the Itis brothers today.
Well, I joke often over the last 30 years with patients, because everyone's got a name for every condition. But the Itis brothers are one that seem to visit more than they should. Why don't you fill us in a little bit on maybe your background? Because I know that you are dealing with a lot of arthritis conditions, or the Itis brothers at your clinic as well as mine. But tell me what you've been doing and what your background is.
So my name is Dr. Mareshah Dunning. I work at Solutions Regenerative Medicine and out of the Neil Reardon Center for Regenerative Medicine. And my focus is actually in pain management. So I like to give myself a really long title of interventional, naturopathic, regenerative medicine pain physician, just because how I approach pain is a little bit differently than you would see from most providers. And so I combine the efficacy and safety from the interventional mainstream pain management. I include the holistic approach of naturopathic medicine and the innovation of regenerative medicine. It provides me a really wide tool set to be able to provide pain solutions for my patients.
Well, if you don't mind, because I often feel I'm an island over here preaching to the wall. But this concept where we come up with names and then we come up with medications for those names, is this just my mindset, or have you noticed this pattern as well?
Oh, I've definitely noticed the pattern as well. You say something so complicated like tendonitis, and a patient hears that, it's like, oh, wow, that's really serious. But then if you really break it down, a lot of these things are actually tendonitis. And if you know actually your Latin root words in English, then you can actually break apart a lot of the different medical diagnoses, and you look at it, and it's a very superficial understanding of what's going on.
Yeah, it drives me nuts because we play somehow into the human need for recognition, and we get a name for something, and then somehow people wear that like it's a label, like it's a characteristic, like, man, I have so-and-so, man, look what I've got. And then they wear that the rest of their life. And so it kind of plays into either I'm a victim or it's just happened to me. I've got bad luck. I have no control over my future because I got bursitis. And man, I just, want to emphasize to our listeners that, you got to realize that you do have control. You do have a hope for the future. You do have a solution. And the name has nothing to do with who you are really and who you will be tomorrow if you just consider what is the cause of that thing. So, Doc, in your world of the arthritis brothers in that scenario, let's just hit a few of these that everyone seems to deal with and maybe break them down so people understand why maybe they have them. Let's start with bursitis. Gosh, my grandma always had the bursa, and it was something, again, she just lived with. But what is bursitis, and what would be the cause of it for the average person?
So a bursa in itself is just a fluid-filled sac. And usually when you're doing ultrasound or different types of diagnostic imaging, you can't actually see these bursa under ultrasound. And it's when they become inflamed that they actually fill up with different types of inflammatory fluid. And the idea of these bursa is to allow your tissues to glide a little bit smoother over one another, or to provide cushioning around joints and tendons or things like that. And so some of them can help to prevent those things from happening. But regardless, it's something that shows up when inflammation or overuse or other things happen to actually create irritation for that. And it's not the bursa being inflamed that's the true problem. It's what caused that to begin with was the overuse or the improper biomechanics or things of that nature.
Boy, you just nailed the two that I have seen. It is proper biomechanics, meaning that when your posture, your positions, your sitting, your lifting, your twisting, or just your general position of your spine is wrong. Your shoulders get rolled forward, your spine gets tilted, your head shifted forward. All these biomechanical changes in your spine and your joints cause it to overwork, and that's leading to the actual bursitis. And then it probably, if you go into number 2, tendonitis, don't you see that as a common cause?
Very much the same too. And a lot of times you have tendonitis and bursitis at the exact same time. And so if you just kind of stick to one of your itis brothers, usually some of the itis brothers actually come together. And so if someone has, let's say, a subacromial bursitis, a lot of times that is correlated with one of your rotator cuff tendonitis, like a supraspinatus. Itis or whatever, tendonitis.
And then again, some of the solutions are going to come into understanding why that became mechanically weak or unstable or abnormal. Let's go into myositis. This is kind of one that a lot of people go to massage therapists, they join gyms. There's big stretching clinics out there that are trying to stretch things. And my understanding and my experience is muscle problems, that muscles only do two things. They move you or they hold you upright. And when you are not moving and not holding yourself upright, your muscles shouldn't be active. They shouldn't be tight. So if you feel your muscles are tight and you're not doing anything, you're laying down and your muscles is tight, is because something's wrong underneath it. Talk about myositis and your understanding of that, if you will, and what can people kind of get to the root of that one?
So a lot of times when I think of myositis, I think of an autoimmune inflammatory condition. But I guess you can also kind of use it just for inflammation of a muscle in general. I think of trigger points where you have knots in your muscles, where sometimes the muscles aren't getting the appropriate signaling and they're a lot more tight because of improper biomechanics and whatnot. And when you get massages and whatnot, you can actually loosen up those muscles.
Well, that's a good one there, because you hit into something a lot of people don't realize, and I think it's a massive epidemic, is this autoimmune disorder leading to these itis brothers. So why don't you expand a little bit more on that thing, because I think people just maybe skipped over what you just said possibly.
So there are different, when people think of arthritis is inflammation of the joint. And there's a lot of different versions of inflammation of the joint. Rheumatoid arthritis is a common autoimmune inflammation of the joint lining that affects the small joints in your hand. Something like osteoarthritis is something that's more degenerative over time, that you can have systemic inflammation create it worse, but that is more of a degenerative condition, where something like rheumatoid arthritis has this systemic inflammatory component. And there's other things like psoriatic arthritis, spondyloarthropathies, things where there's a systemic component that is driving these inflammatory processes.
What about gout? Is that in that category?
So, gout is more of a uric acid crystal. It's a metabolic dysfunction as opposed to a true autoimmune condition, but it is a more systemic cause than an autoimmune cause.
Just because our average listener is not a medical provider, just even explain systemic, because you say that word like I do, and we know what we're talking about. What do you mean by systemic?
Let's take it back to like the tendonitis aspect of things. So let's say we have people a lot of times know their rotator cuff. We'll go to the supraspinatus because we were talking about that. You have overuse of a very local area. The supraspinatus is inflamed locally because you have something very specific happening. But when you're talking about something systemic, it's something larger than that local area that is driving it, whether it's immune dysregulation causing an autoimmune condition, or if it's metabolic issues like diabetes or cardiovascular. Those are more systemic things that have an effect over your whole body as opposed to something that is more local.
I think if you're listening to this thing and you are dealing with pain, that right there is a huge thing to understand. So many people get so confused, and they'll come in and they have like 5 different problems going on. They have an elbow problem, a knee problem, a back problem, a neck problem, and then their foot is bad. And they somehow have been taught to believe they have 5 different problems. What she just described to you is something you've got to grasp. When you have one isolated issue and you have overworked a tendon, you will get tendonitis. And when I ask you as the doctor, where does it hurt? You'll take your finger and you'll touch a specific spot. That right there is diagnostic for you and for me that you have something localized. But when you have these other issues, systemic issues, underlying gouty, metabolic issues, autoimmune issues, you're going to take your hand and I say, show me where it hurts, and you're going to rub in an area. You're going to notice, you're going to put your hand and go, it's in this area. You'll rub your knee, you'll rub your shoulders like in a circular pattern. If you notice this at home, you can diagnose yourself right now. And if you have 5 problems, chances are you don't have 5 problems. You have one systemic issue going on that's creating 5 different areas that are inflamed, 5 different Itis brothers. They may give you 5 different names. I'm telling you, I'm betting it's one underlying systemic issue.
Hey, this is Dr. Kevin Wall here. Think about it. We changed the air filters in our homes, the oil filters in our cars. What about the one filter that cleans your blood, your liver? After years of toxins, no wonder you're feeling sluggish, digestion slowing down, blood sugar getting off, and your energy dropping. That's why I personally recommend the Push Catch Liver Detox. What makes it different is that it addresses all 3 biochemical phases of detoxification: release, filter, and eliminate the toxins safely. It's easy, effective, and it's the one cleanse I trust. Reset your body, restore your energy, and get unplugged. Start your liver cleanse today at drkevinwall.com.
Doc, what are the most common systemic problems? Let's maybe get deeper into past the names to why would someone get gout? You say it's a uric acid crystal, but it's coming from something else, isn't it?
Well, so that's where certain people have different predispositions for different types of diseases and outcomes. So gout is actually a uric acid buildup within the joints. And so they have an improper metabolism in their body to actually get rid of uric acid. And they have certain diets that actually create things that are worse for them. So things that are high in purines with gout tend to make those things worse. So yes, beer is high in purine. So people that are having gout flare-ups, they should be avoiding things that have high purines, which purines is one of the constituents in proteins. And so this is actually one of the few cases where I actually tell people that maybe you need to be careful with your protein diet.
My understanding is it's typically the red meats more than the other meats. Is that true?
Yes, that is true. Red meats do tend to be more aggravating for people with gout.
All right, what about psoriatic arthritis? That's systemic by nature. Where's the root of that going to maybe stem from?
Sure. So psoriatic arthritis, so a lot of people know psoriasis. And psoriasis is a dermatological condition where you have kind of like a rash on your extensors, like on your elbows and your knees and things like that, where you have these flaky rashes on those. And it is an autoimmune condition, and it is correlated with different spondyloarthropathies, which is psoriatic arthritis is one of those, where it actually this high level of inflammation actually starts to affect your joints as well.
So you wouldn't relate that to diet, though, in that aspects?
Oh, I most definitely would. And it's just kind of bringing, when I talk about inflammation with it, it's bringing in that systemic component. So when you're bringing in something systemic, then you're actually looking at all of the different systems that could be affected by that. And diet would definitely be correlated with that.
Is that the most common one? Or again, to help people maybe get to the root of it, I just want to try to get past some of the big words and the names and help people understand why are they having psoriatic arthritis. Because my understanding, when I see the skin bad like that, I go to the liver. Because when the liver's not cleaning, your body's not cleaning, your skin's the biggest organ of elimination, probably outside or maybe even above some of the other areas, orally and anally. And when your body is psoriatic and when you got skin issues, when you got rashes, I'm thinking liver, I'm thinking internal elimination, digestion, absorption, food.
Most definitely. And so, when it comes to food sensitivities, so certain things like gluten, dairy, soy products, those are some of the more common allergens. And you can do different food sensitivity panels that can drive this inflammatory component. And when you have inflammation in your gut, that can actually poke holes into your gut lining. And the more that you have holes in your gut lining, then you have some of these toxins actually come in systemically, and more inflammation. Your body starts recognizing things that are supposed to be nutritious for you and actually starts attacking it and creating this low level or even high level of inflammation. And once that starts creeping up, then you can start having more stagnation in your body and having more of a difficult time for your liver to metabolize different toxins and to kind of quell some of these inflammatory things going on in your body.
I promote a liver detox. It's a very popular one. It's very effective. Do you help people? Do you ever put people on those things when you see these type of systemic issues going on?
So one of my favorite things to kind of help with liver congestion is something called milk thistle. Have you ever tried that?
Well, I've definitely prescribed it. I know it has the benefits of doing some of that stuff.
And so milk thistle is one of the botanicals that I do like to when I'm doing kind of a cleanse protocol. And there are many different variations of cleanses that I do with patients. And milk thistle is something that I like to provide to help to get the liver moving its juices. It's something called a bitter. And so bitters actually stimulate your gastric and pancreatic liver enzymes to actually digest your food better. And by doing that, it also helps to restore your liver and assimilate food. And so that's one adjunctive thing that I provide, but also kind of getting kind of like an autoimmune type diet. There's the autoimmune paleo diet, there's Mediterranean diets, things that are going to eliminate a lot of these common allergens while also supporting your body in ways that has enough protein, a lot of the healthier fats like omega-3 fatty acids, a lot of the antioxidants with fresh fruits and vegetables. That's kind of like a holistic way to kind of go about it. But then there's also, I don't fully like putting people on like juice cleanses because I do feel like they do need other types of components like with the protein aspect, but there are different combinations with protein based like smoothies as well as juicing that you can kind of do with that.
So the autoimmune disorder issue is rampant, and we have got to look at ourselves, our diet, what we're doing versus what the pharmacy has to do for us if we're ever getting out of those things. Out of I said 22% of people are dealing with arthritis today. How many of those do you believe, or what percentage of arthritic conditions out there are systemic versus genetic? Like rheumatoid is the only one that I even know, honestly, that has a true genetic marker. But what are these other ones out there, systemic versus genetic?
So, I mean, there is a different genetic component with a lot of different ones of them. They are tend to be a lot less common. So, when you talk about like the spondyloarthropathies, where you have ankylosing spondylitis, that's related to HLA-B27. And then even with rheumatoid arthritis, yes, there are some genetic predispositions to it, but there are actually have been research to show that different infectious etiology can actually create certain autoimmune conditions to actually become more prevalent in a person. And so, yes, we have our genetic profile, but with every person, it's the epigenetics and our environment that actually trigger certain things to be cued in our genes.
Wow, I love that. It's one of my favorite words. I did a podcast on epigenetics, and so many of us have been thought that our parents were the fault, that I got it from my grandma, my dad, they gave it to me. And there's no doubt your genes came from above you, but the epigenetics is the actual expressing those genes, meaning that you become susceptible to those genetic weaknesses based on stress, diet, toxicities, your ability to eliminate, digest, metabolize. Would you agree with all that, or do you think I'm off my rocker on some of that?
Oh, you're 100% right on that. And that's part of what I try to teach my patients is like, yes, we have our genetic predisposition. And for some things, when if you have like cerebral palsy and things like that, it's like, well, yes, like there is a true genetic expression of that. But with a lot of the different genetic conditions, we actually have a lot more control on the expression of those or even the management of those if we actually truly understand epigenetics and the physiology that actually brings out those different types of genetic disorders.
All right, well, we're going to switch gears here a little bit, but I really hope that you heard what I was trying to get maybe communicated, or Dr. Dunning was communicating, is you have control. If you're dealing with the Itis brothers, if they're visiting, if you want to evict these guys out of your residency, you have the ability to do that. And that really comes from simple things like diet, detoxing, cleansing. But let's talk more about the most famous brother of all, the Rudolph the red-nosed reindeer of all of the Itis brothers, the one everyone wants out, Arthur. Osteoarthritis. If I'm going to lump in the arthritis conditions that I see, that I believe that are out there, I would put over 50% of them in the osteoarthritis category, meaning that your joints are breaking down, not because of genetics, and it may not even be your diet, although I think that's probably adding. This is the condition osteoarthritis, which I call a moving arthritis, meaning that you're not moving. Doc, why don't you talk about osteoarthritis? I'll throw my 2 cents in at the end, but why don't you take it and explain what you believe osteoarthritis is and what the cause is?
So osteoarthritis is actually the number one thing I do treat in my clinic for pain. And so I would agree that it's definitely well more than 50% of people that do see the Itis brothers. Osteoarthritis is the number one cause of that. And when we think about osteoarthritis, it's really degeneration of our soft tissue, like the cartilage in our joints. And so how do we get to this point where we're having degeneration? And you'll have certain patients that come in as like, oh yeah, well, my parents both had knee replacements and all of those different types of things. And sure, we have different patterns and behaviors that our parents and our family kind of bring down to us. But a big component with the osteoarthritis is how we move about and how we interact in the world. And so if how you move about in the world allows things to wear inappropriately. So I like to give the analogy of balanced tires. And so if you don't go and get your car aligned every so often like you're supposed to, the wear on your tires are going to be uneven. And so if you don't have proper alignment in your body, then things in your joints and tendons and ligaments, they're going to wear inappropriately and cause damage. And there's other things like the systemic component. So if you have a lot of inflammation in your body, the likelihood of you actually degrading those joints and having those things happen, yes, it is more likely. And so there's a lot of different components that are playing into it, but you're 100% in control of what is going on if you actually take ownerships like, okay, well, I need to actually correct my posture. I need to correct my movement patterns and go to the gym more, eat foods that actually nourish my tendons and joints to actually heal better and move better.
Would you say osteoarthritis can be stopped and reversed? At what level does someone get where they're stuck this way the rest of their life? Is it possible?
So if you look at the different studies, they kind of, if someone gets osteoarthritis, if the prognosis of it is that it is a continually degenerative condition over time because it's a condition that's associated with aging. As a regenerative medicine doctor, I see things a little bit differently, where I get patients that have grade 3, grade 4 osteoarthritis, and they're looking for alternatives to getting surgery or taking opioids. And the idea is that you can use different things like physical therapy to correct some of these biomechanical aspects, and then layer in naturopathic principles of diet, lifestyle with the innovation of regenerative medicine. And I have a hard time saying reverse. But just because the studies that support regenerative medicine, there aren't a lot of different studies that completely show complete reversal of a grade 4 osteoarthritis. But what I do see in my patients is that they're either completely out of pain or significantly out of pain, and they have a better quality of life. They're moving more, they're reaching their goals, they're playing with their kids. Like, those are the things that I really measure in my practice, and people are getting that.
Well, it is the number one reason I say that patients see the doctor. It's not pain, is because their lifestyle's taken away. And the great news is you're 100% right. You can reverse that part most all the time, meaning that you can get people back to living life at a higher level, at functioning, enjoying, and playing and working and doing all the things that they want to do. You better believe it. If you're listening to this thing and someone told you you have osteoarthritis and your progression is guaranteed, you're getting worse, you're getting bad, well, that's really true if you believe it's true. But it's not true if you decide it to not be true. And here's just the science behind it. That your joints, your cartilage, your ligaments, your tendons, the white tissue in your body is what is termed as avascular tissue, meaning it has not a blood supply. Well, if you understand anything simple about your health, is blood brings oxygen and nutrients to all of your cartilage and tissue and your muscles, and your every cell in your body needs oxygen and nutrients, and your blood is the major supplier of that. So if your white tissue, your cartilage, your ligaments, your tendons are not vascular, you have to ask the question, how does it get blood supply? How does it get nutrients? How does it get oxygen and remove carbon dioxide? And the answer is movement. You have to be moving. Your joints have to be mobile, agile. And if they're not moving, for every degree of range of motion, you can sit home right now and do this test. Turn your head to the left, turn your head to the right, stand up, sit down, fight, fight, fight. No, if you can't turn your head to the right or to the left or bend your head to the right, to the left, you have lost range of motion. For every degree of range of motion you have lost that percentage of oxygen exchange to that tissue. Guess what the actual recipe for arthritis is? Reduce our oxygen, reduce nutrients, increase carbon dioxide, increase waste products, and you will degenerate the joint. That's a guarantee. It's not a myth. It's not a belief system. So the opposite is true. If you want to reverse any type of arthritis, degenerative, osteo, then you have to increase oxygen, increase nutrients, reduce carbon dioxide, reduce waste products. And the way you do it is the way Dr. Dunning just talked about it. You got to get to the gym. You got to get moving. You got to get stretching. You got to get active. You got to get adjusted at the chiropractor. You got to go to the regenerative medicine clinic and find out how to get out of pain so you can get moving again. Doc, when a patient comes into regenerative medicine clinics like yours, what do they expect to have happen? How do they get? Because I've seen they stop moving because they're hurting, right? And so that, though, is like just gas on a fire. As if you understood what I explained, you stop moving, you are going to throw gas on your arthritis. But I get you're hurting. I get you got to get moving again. Doc, what do you tell people? How do they get out of this cycle?
And so that's the tough part, because people are in pain, and pain a lot of times is a signal. It's like, oh, stop doing this. And a lot of times that in itself actually progresses their condition, because if you stop moving, then your muscles stop building, you get muscle atrophy or muscle breakdown, and then you don't have the strength keeping stability in those joints, and then you further perpetuate this cycle. And so it's about understanding what pain is healthy and what pain is dysfunctional. And so to some degree, when you're going to physical therapy and rehabbing, you're going to have to deal with some level of pain. It's just when it's out of control that you need to kind of hone it back in. And that's why sometimes if it's gotten to a certain point that you do need a professional like myself, like you, or other people to help hone things in, so that way they're not progressing things along, because they just don't know how to move their body appropriately. And they've done this for so long on their own, and they've gotten it to a point. And so part of it is just helping them to understand that they've come to the right place, and that we're going to help kind of guide them through this process of being able to move better. And that's the great thing with regenerative injections. I can help to decrease their pain, so that way they can go and move better a little bit more comfortably.
So is a regenerative injection different than when I go to the orthopedic and get a cortisone injection? Is this similar? Is this different?
It is very different. And so steroids, once again, is kind of feeding into the model that you were talking about, is that, okay, we have inflammation, we have an itis, we're going to do something that decreases that inflammation and that itis. But that's once again looking at things at a superficial level. And yes, to a point when inflammation gets so out of control, then you need to figure out a way to decrease it. But there's other ways to do that outside of using things like steroids. I don't know if you've heard of the solution alpha-2 macroglobulin, or A2M. It's kind of the counterpart to steroids in the regenerative medicine realm, where it actually binds these different inflammatory markers like IL-6, IL-10, and actually binds them and helps your body metabolize them and get them out of your body. And it also binds certain enzymes that break down the joint cartilage, like metalloproteases, that have been actually correlated with osteoarthritis.
After an injury, it can feel like life's on hold. But at AFC, we're here to help you get back to what matters. With personalized injury plans and our expert staff, we don't just treat the pain, we guide you back to strength and confidence. Because getting back isn't just about healing, it's about thriving. Call us or visit our website to start your journey today.
So there's a major difference. Regenerative medicine is really in the category of natural, more holistic, and working with your body, not just overriding the red light signal, right? I always said if people just sprayed their own light over and kept driving, no one would be on the roads anymore. That'd be great for traffic. But that's how they're doing this at the orthopedic clinics. They're just hammering the red lights. They're just cutting the wires and expecting somehow we get healthy cars out of this. So yeah, everyone's broken down the side of the road. You're getting them going. Is this like stem cell stuff? Is that in that category? Is that a different category? Or what about peptides? Are those in the category of regen?
So all of those, yes, are definitely in the category of regenerative medicine that's working with your body to heal. Because when you're looking at things like chronic conditions, like with degenerative conditions, you talk about steroids. Steroids is actually putting gasoline on the fire, because you have a tissue degenerated, and then you're going to put something in there that degenerates the tissue even more. When you're looking at regenerative medicine, your body has not mounted enough of a response to heal that area. So you're looking to regenerative medicine to bring in the signals for your body to recognize these areas again and heal it better. And so there's different grades of that. So there's things like on the lower level, like prolotherapy, where you're using dextrose to kind of reignite that signal, or you're going to different areas of your body to concentrate those signals of healing, whether it be in your blood with platelet-rich plasma, or stem cells through from yourself through fat, bone marrow, or getting donor tissue from different like perinatal tissue like Wharton's jelly or stromal vascular fraction from young healthy adults, things like that.
A lot of people kind of lean away from the stem cell because of some of the FDA baloney that says, oh man, if they don't say it's good, it can't be good. And they're the ones over there killing everybody. But, and then the concern of amniotic fluid and fetuses and abortions and all that stuff so when you're talking stem cell, we're not talking that source, right? There's other sources.
So, I mean, technically we are talking about the similar sources, but with FDA regulations and all of these things, that's part of the reason why when you asked me the question of, well, can these solutions reverse osteoarthritis. And that's where I get a little bit more careful with my wording because of FDA aspects. So making a claim that I'm going to do these regenerative solutions and that you're going to now be healed of all of these things are the extreme claims that the FDA kind of has an issue with. But if you understand how all of these things work on a physiological level, it makes sense that all of these things are helping and supporting your body to heal and to regenerate and to get back to its normal version of homeostasis. And so when you're talking about like Wharton's jelly and all of these abortions and things like that, all of the different types of donor tissue that are available, these are post-birth tissue. So these aren't being taken from abortions. These are live, healthy births that go through the FDA guidelines of certified good manufacturing practices. They're screened for infectious disease. They go through all of the hoops and bells and whistles, and these products are registered with the FDA. There just hasn't been the robust amount of clinical trials to support every single indication for every single thing that you can use for all of this stuff. But if you look at the research studies and you look at your functional medicine aspect, there's a plethora of information and scientific evidence that supports these things helping individuals recover from these conditions.
So can you get stem cell injections at regenerative at your location?
So I do donor tissue. I do the autologous and allogeneic forms. And so with the autologous forms, that's where you're looking at stuff from yourself. And so I do fat transfers where I actually harvest fat from the abdomen. I harvest bone marrow from the actual pelvis. And all of these places are known to be high in mesenchymal stem cells, which are known to help rebuild connective tissue like joints, tendons, ligaments, muscles, all of those things. And they have a very definite outcome for that. And then there's the allogeneic products, which are the donor tissue, which is where you're looking at the young, healthy adipose tissue or the perinatal tissue as well.
All right. Well, who wouldn't like a little belly fat being removed and make my joints feel better? That sounds like a good plan. I like where you're going with that one. All right. Well, Doc, we're probably going to wrap this thing up, as I always try to keep time conscious on our podcast. But why don't you give us the number one myth that goes out there when we talk about arthritis that we just need to debunk today? What's the number one myth that you would bring up?
That just taking something simple, like a simple supplement, like if you go out and just say, oh, I'm going to take glucosamine and chondroitin, that's going to be enough to heal my joints from osteoarthritis. It's really, it's a whole person approach. People like to look for the quick, simple fixes in order to get themselves feeling better. And really, it's not just regenerative medicine, supplements, physical therapy, all of these things. It's really looking at the whole person and really changing your lifestyle and the things that got you here to begin with. Because the body that is going to heal isn't going to heal in the same conditions that got it sick.
I love that one because that unfortunately leans right off of what Big Pharma has done, that they've taught us somehow you can buy your health at Walgreens. And you can buy your supplements at Costco. Holy mackerel, that glucosamine Costco bucket of stuff they give, that stuff, I don't think there's any benefit in that. I'm sure there's not much, but supplementation isn't your answer. It's a part of maybe your answer, but I think you're 100% right. You got to find a team that can work with you, logic, function, get moving, get active, get digesting. Do add some supplements maybe, but don't just stop there like somehow there's a magic pill out there. All right, Doc, well then do this. What are the top 3 things everybody needs to do to either get their arthritis better or prevent having it?
Well, one, you got to fix your biomechanics. Start moving more. Correct your posture. You need to go to the gym. You need to work out more. And a lot of women are afraid to put on muscle mass. You know, you're not going to just turn into Arnold Schwarzenegger by going to the gym 3 times a week. So make sure that you're actually going to the gym, working out, lifting heavy, increasing your bone mineral density and muscle strength. 2, eating a diet that is rich in nutrients. And so if your body doesn't have the cofactors or the nutrients it needs to heal and repair, it's not going to be able to do so. So making sure that you provide the overall quality of nutrients to be able to allow your body to heal appropriately. And then 3 is don't Don't ignore things. So if your body is hurting, make sure that you go and find someone that can help you with it, as opposed to letting things progress over time.
Yeah, I love those, Doc. That was well said. And that red oil analogy I said, you guys have got to hear. You have got lights going off in your car all day long. Headaches, joint aches, muscle aches, toothaches, toe aches, stomach aches, and you keep thinking spray paint is your answer. You've got to stop doing this. There is a reason your gastro is itis. There is a reason your stomach's inflamed and your joints are inflamed. She just hit the top 3. I think I'm just going to quit there, because if you did those 3 things, you're going to evict half of the Arthritis brothers from your home. And that's the plan. And that's the reason that we did this podcast today. So, Dr. Dunning, if you would, if they can find you, they want to find you, can you tell everybody where you're at, how to find you, where to look you up?
So I work in Tempe, Arizona at the Neil Reardon Center for Regenerative Medicine. That's the location I work at, but I work at Solutions Regenerative Medicine. So you can look me up on my website at solutionsregenerativemedicine.com. I'm on all the social media platforms like Instagram, Facebook, TikTok. So come check me out and see what I'm up to.
All right, there you go, guys. This is Dr. Wall and Dr. Dunning, and we're going to check out here from the Unplugged Healthcast. Always remember, never give up, never give in. Be healthy, be blessed, and go get those arthritis, itis brothers out of your life once and for all. Check out Dr. Dunning and check us out. Make sure you follow us, share these podcasts with people that need help, because they're not finding it at the CVS. You don't buy your health in a bottle. You figure it out, and you have the ability to get it within your own grasp. All right, well, we'll see you again on the next Unplugged Healthcast. This is Dr. Wall. We're signing off.
The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.